This is David Holt. I'm going to discuss how to give Rocephin, which usually comes in a 50cc bag, IV piggyback. And you will need a 2 IV tubing setup in order to give a full dose of Rocephin. The focus of my books and my website is the fact that 93% of the nurses that I've watched, 28 out of 30 nurses, have failed to give a full dose of IV antibiotics, and I've written 4 books on the subject of where they're going wrong and what they can do to correct it. One of them is this book on this list, 7 IV Antibiotic Mistakes, and that's available at Kindle and at the Barnes & Noble site, ebooks. So you're going to set up your IV tubing with a flush bag, and you're going to back prime into your secondary tubing. Then you will connect your 50cc bag of Rocephin. The 50cc bag is usually given over 30 minutes, so your IV rate is going to be 100 cc's per hour. Now, the fact that there's about a 5 or 6 cc overfill is irrelevant, because you're only going to have that 1 gram dose or that 2 gram dose of antibiotic in the actual bag. The additional 5 cc's of liquid does not give you additional drug, so the rate will still be 100 per hour. The problem that nurses have is that they do not program the volume to be infused for sufficient to clear the IV tubing of the antibiotic. All but 2 nurses that I've watched have programmed the IV pump for only 50 cc's. Now, it doesn't seem unreasonable on first consideration of the subject, but what happens is after 50 cc's has gone through the IV pump, there is still 5 cc's in the bag, and of course the entire IV tubing is full of antibiotic. The patient will have only received half of their antibiotic. So what you need to do is use something along the line of Holt's 30cc rule, which means adding the volume in the bag, 50 cc's, plus 30 cc's as a guaranteed minimum to give you 80 cc's for your volume to be infused. If you always program your pump when you hang a 50 cc bag of medication, if you always program the pump for 80 cc's, you will usually give the full dose of IV antibiotics. There are a few exceptions. If for some reason you have a double mainline IV tubing, you're going to have a lot more tubing than usual, and you should look up Holt's IV rule number 2. And you can do that on any fun-filled iPad, iPhone, smartphone, or even a computer, chair support. So there you go, it's quite simple. Hate to see the word simple, because for most of us that means it's going to be difficult. That this one requires that you use some basic math, or as they say in England, maths. Never quite understood why they made it a plural when it's a single subject, but that's, I suppose, because we call it mathematics over here. So go forth, use your basic math or maths, and give a full dose of antibiotics every time. Please, your patient will appreciate it.